Hello and welcome to all of you here in Kigali on the African continent and around the world. This is Let's Talk About Health in Africa on Utano podcast with me, Lenias Hwenda. Today on Utano podcast, my guest is Kendall Taggart, an investigative journalist for Bloomberg News. Kendall is here to talk to us about her observations of the $200 billion counterfeited medical product industry that she has been investigating and reporting on at Bloomberg News. Kendall, thank you so much for coming on to Let's Talk About Health in Africa on Utano podcast. It's my great pleasure to have you on.
Thanks so much for having me.
Excellent. Now, Kendall, I'm curious, what got you and your colleagues at Bloomberg News started with your investigations into substandard medical products?
We got really curious. I guess it would have been early 2023 to better understand some of the medicine quality issues we were hearing about, both in the US, but also manufactured for other parts of the world, sometimes by completely different manufacturers, and sometimes allegations of what I've heard called dual tier manufacturing, where a manufacturer will have one product that they're sending to, quote, heavily regulated markets and other products that they're sending to different countries, including some of the countries in Africa. And as I'm sure you remember, there was a lot of attention on cough syrup contamination that had occurred, and a number of children who had died after taking cough syrup that was found to have a poisonous substance in it. And it became clear that while that was getting some headlines, this was not an issue limited to cough syrup or a one-off incident, but something that was happening over and over again. And so we really wanted to understand what were some of the drivers behind that, who were some of the manufacturers behind some of the medicines with repeated quality issues, and who were they being sold to, and how are they being detected or not?
Yes. So can you maybe elaborate on some of your findings? What are some of the major drivers that you have come across in your investigations?
Most recently, we were looking, as you know, for every kind of medicine, there can be such a different kind of supply chain and such a different manufacturing process. But most recently, the kinds of medicines we were looking at were chemotherapy drugs. And as diagnoses have gotten, the technology to diagnose and the access to medical professionals who can diagnose cancer has gotten better and better, that's seen a huge demand now for more chemotherapy drugs, but a lot of procurement agencies are prioritizing low cost, above other factors. So one of the things that we discovered, and I can get into it in more detail, but was looking at a manufacturer who, despite repeated problems with their products, was able to continue selling them over and over again, sometimes to regulators who it wasn't even clear that they knew that, oh, actually in Latin America, there had been this problem, and in Ethiopia, there had been this problem, and in India, there had been this problem, because the regulatory oversight can be so disjointed and so fragmented.
Yes. No, that's really concerning that actually you have these manufacturers that have a record of of questionable quality with their products. So you're finding that it is the cost consideration that is driving buyers of medicines to overlook quality issues and just buy from manufacturers of questionable medical products quality.
I think cost is a big driver, and cost isn't necessarily a bad driver, as you know, right? We all need medicine at accessible prices, but we did talk to hospitals and others who are buying medicine where cost was the only factor they were allowed to consider, and that made it really hard to give business to manufacturers who are maybe investing in some of the quality procurement standards that you'd hope would be there to ensure that medicine was sterile, to ensure it had the right amount of active ingredient. So there wasn't really the same business incentives that you would hope would be there to help manufacturers invest in that. And then the flip side of that is I also think there aren't many penalties when a manufacturer has a problem. So I guess there's both a carrot and stick problem from our reporting.
Yeah, I guess that makes it very difficult if people are, buyers are being given the only metric, the main principal metric to be the cost to the exclusion of everything else. But so now, what can you tell us about your findings, what you have found around the cancer medications that were sold in Ethiopia and perhaps in other markets as well, outside the African continent?
Yeah, we were looking at a particular cancer cancer drug manufacturer called Naprod Life Sciences that's headquartered in India, not too far from Mumbai. And they primarily manufacture for Latin America, Southeast Asia, and certain countries in Africa.
Yes.
And what we found is that in 2020, a number of children at more than a dozen different hospitals started getting sick, and doctors were reporting adverse events to the main Colombian FDA. And despite all these problems, it took many months for them to realize that a number of the batches of the medicine that had been sold in Colombia contained a bacteria, even though these are supposed to be sterile injections. And after receiving those drugs, at least 4 children had died. A number of others had suffered really severe consequences. And so when we saw it, and then there was a recall. After that had happened, the Colombian FDA issued a recall of all of Naprod Life Sciences products in the country. When I saw that incident, I started trying to understand, okay, was this the first time that manufacturer had problems with their drugs? And it turned out it wasn't. One of the first ones that had been identified, at least publicly, that we could find was by researchers both at the Ethiopian FDA and collaboration with a researcher here in the US who just kind of on a whim decided to test samples that happened to be in a hospital's storage closet, essentially. And they were trying to figure out if this new cheap-ish test they had to detect active ingredient was effective.
Yes.
They weren't looking for particular problems with that company's medicine. But when they got the samples back, almost all of them looked like they didn't have enough active ingredient. And when they did additional follow-up testing of this chemotherapy drug called cisplatin, they found many of them had half the stated active ingredient or less, which oncologists will tell you can be incredibly dangerous for people who are relying on precise dosages and precise treatment to eliminate the cancer in their bodies. And then there were other problems that were similar that had come up in India as well, with regulators testing medicine there. And as someone new to this field who hasn't been doing it as long as you have, that genuinely surprised me that a manufacturer could have incredibly dangerous quality concerns linked to its products over 5 years. And as far as I know, they haven't faced a single fine and are still registered to sell in every country that problems had been found in.
Wow, that's really, I mean, shocking, but not, for us who's been working in this area, we've been aware of this challenge for a long time, including the issue that you raised earlier of the dual sort of quality production, for some markets, lower for some markets, and higher for stringent markets. So, but in this case, I mean, did the Ethiopian authorities raise it with CDSCO, the Indian regulator? And if so, I mean, what was the response?
My understanding, mostly from talking to the US researchers, is that the Ethiopian authorities did take this very seriously. We tried to reach out to them multiple times for our reporting and have not been able to get a response yet. But my understanding is that they were extremely concerned about these findings and wanted to take prompt action. But I don't know what ultimately happened.
Yes. But the case that you're recounting there is very similar to the cough syrup issue that we had, which killed more than 70 kids in the Gambia, in West Africa. Now, and it's very similar in terms of the lack of accountability or consequences to the manufacturers. In fact, the manufacturer of the cough syrup in the Gambia, it's my understanding that they also had numerous flags of quality issues with their medical products. Now, talk to me about how widespread this problem is from where you're sitting. You're investigating these issues in various markets. I mean, what are you seeing?
I think one of the things I was most struck by is we really don't know. There's so little testing done on any kind of large scale, particularly outside some of the cheaper medicines that are procured on massive scale by places like the Global Fund or others. But with chemotherapy drugs, they're toxic. They're very difficult to, not that you need certain labs to be able to test them. Most regulators aren't just doing random sampling of chemotherapy drugs that are coming into their country. So the fact that these issues were detected in the case I was talking about, both in Ethiopia, Colombia, and India with Naprod Life Sciences medicine, was almost a fluke. And so I think that the problem is something that we really don't have enough data on
Yes.
to know how big of an issue it is, but certainly big enough that any of us who are dependent on these medicines should be concerned about it.
Yes, no, we do see the same thing, at least in African markets where we're working. There is no systematic gathering of data, and that really limits your ability to even make a case that this is a big public health problems, that is a threat to the safety of patients in countries. So that's really difficult. But I had hoped that, maybe in countries like the US or other markets that perhaps they do better than African countries are doing at the systematic gathering of data to better understand the issue.
My understanding is that the US has taken a slightly different approach that I think there's pros and cons to both, but that essentially the idea you could test your way into compliance or understanding is not feasible, and that you really need an inspection program that can detect these issues on site, and that's the way to effectively ensure a safe supply chain. So in the US, we don't have a ton of testing data, but for slightly different reasons.
Yes. Now, it's true that you can never be too complacent with this. You always have to be constantly checking and inspecting manufacturing facilities and testing the products that are coming in. But part of the problem, of course, is that, they have to do this risk-based testing of the products. But what's happening upstream is that the manufacturers are substituting cheaper ingredients, actives, and excipients to cut down cost. And so that makes it very difficult, in my view, to then assess the risk if there is widespread substitution that is going on with what is going into the medication at all. Now, are there any cross-cutting issues that you have come across, regardless of which market that you're looking at, that really contributes to regulators having difficulties in detecting these products slipping through into the markets when they should be stopped?
Certainly, on two fronts. One issue we learned about was that in Colombia, for example, but I don't think this is unusual, none of the inspections that they conduct are surprise visits. They are announced many weeks in advance to all the manufacturers that are selling to Colombia, so that Colombian inspectors who are flying over there can go visit multiple places over the course of 2 weeks. And that's for cost reasons, because doing it otherwise would be extremely expensive. And also, I think there's pushback from the manufacturers in India about doing it any other way. But that makes it pretty difficult to detect problems if someone knows you're coming weeks in advance. So that's one place where the costs and resources devoted to oversight are limited and are maybe not enough. Another place that we saw it was we talked to dozens of former employees of the chemotherapy drug manufacturer that I was talking to, and they would talk about being pushed to do sterility tests to make sure that there was no bacteria in the medicines too quickly to be able to do them effectively, and other pressures to move through very basic, sometimes maybe even boring, routine tests, but that if they're missed or done incorrectly have potentially fatal consequences. And I don't think that's the kind of thing that you can detect from testing the end product. Like you were saying, that's something that you need to be able to have a pretty visible presence within the factories themselves to understand it, and to have manufacturers really feel like if they cut corners in that way, it might be detected.
One always imagines that, the people who are actually buying products that are substandard, that are counterfeited, are doing so because they are being duped by the manufacturers of counterfeited medical products. But you have documented, substandard misoprostol that was being bought by a global abortion pill provider who was buying from a manufacturer that they were aware had a questionable record of quality. Did you talk to them, about why they would do such a thing? Why would they choose to buy medications from a source that they knew had quality issues?
Yeah, so I think you're referring to, we were looking at a manufacture of both, it's an abortion pill called misoprostol, but also used to prevent postpartum hemorrhaging. So it has two different uses, both important. And what we found was a manufacturer also based in India called Sinochem Pharmaceuticals. Frequently, Indian regulators who had just sampled their products on the market, gone to places where it was being sold or used, had found that it didn't have enough active ingredient. And in addition, a global nonprofit called the Concept Foundation had tested samples of their medicine in a number of countries, I believe, including Nigeria, Kenya, and elsewhere. But I should double check that, actually. I think it was, no, not Kenya, I was wrong. It was Nigeria, Congo, Uganda, where they had been picked up samples and found that they contained impurities that are not supposed to be in the product. And despite this track record, a large international nonprofit, DKT International, was buying from them and continues to buy from them to this day. They have said that they stand by the quality of the products that they procure and that they do their own independent testing on the samples that they receive. The samples that had been picked up as problematic in the market and potentially dangerous were not ones that had been sold under that nonprofit's brand name. Nonetheless, I think it obviously raises quality concerns about how reliable the misoprostol made by that manufacturer is if frequently samples are being detected with these kinds of issues.
Indeed. Now, on the African continent, in a lot of countries, what we find is that a lot of people who are buying medicines, I don't know whether really they are genuinely unaware or whether it's just, well, we will just pretend we don't know so that we're able to buy where we can find the cheapest medical products. But what you find when you talk to people, I'm in Kigali right now in Rwanda in East Africa, and I have been talking to many distributors, wholesalers who are involved in buying medicines. And the single most common answer that you get when you raise the issue of substandard medicines is that, well, no, it doesn't exist in our market. Actually, our regulators are on top of it and it's not a problem. Now, is that a perception that you find in a lot of these markets where you have investigated and, obviously this is a challenge? How do you find the level of awareness amongst people who are buying medicines, but also amongst regulators themselves?
That's a good question. The one that first comes to mind was the Colombian regulators that we were talking to about the chemotherapy drugs. And I think that we did not find the Colombian regulators eager to talk about the problems that had been found. I think public health officials are often put in a difficult position where once there's a problem, they are concerned about being blamed for having failed to detect it before it happened. So we found it really difficult. And my colleagues who reported on the cough syrup situation as well also did, to have honest conversations about the scope of the problem, the limited resources that may have contributed to it in the first place, and what really needs to be done to prevent it in the future. Because there was a little bit of a sort of hunker down and hide mentality among public health officials that really did surprise me. I thought we would be able to find people more willing to talk about this more openly and candidly. But there's, I think, a lot of blame that simultaneously gets laid at the feet of FDAs globally that makes it difficult. And I think the WHO's programs that work to address these issues are similarly trying to balance their relationships with major producing countries like India, as well as the regulators trying to prevent problems from entering their market. And that balancing act does not always lead to a robust public conversation.
Yes, and it really leaves patients very vulnerable because obviously if the gatekeepers are not being forthcoming about the problem or its existence, then it makes it very difficult to effectively take countermeasures to prevent the challenge. And now to conclude, I mean, with all of that, what you're seeing in your investigative reporting at Bloomberg, I mean, do you think it's possible at all to protect patients with regulators not able to really confront the issue openly and say, yes, there is a problem, it's a big problem, and we need to deal with it. We need to have a conversation with producing countries like India and China to see how we can best mitigate that challenge and protect patients?
I think I did see a lot of efforts that gave me hope this problem. It certainly is not inevitable. We actually know how to prevent it. We know how to do effective oversight. We know that inspections can really work. The WHO pre-qualified program that many of your listeners are probably familiar with has improved the standards at many manufacturers. But I do think it's going to require more candid conversations and more openness about this than we have to date. I've seen efforts also to coordinate better across regulators. I know there's a big effort right now in Africa and otherwise that could at least help prevent, something happening in Ethiopia, and that meaning that Nigeria doesn't even know the problem occurred, and those kinds of collaborative efforts, especially in markets that are smaller and that their weight of the consequences of saying, okay, if you sell us a substandard or poor quality product here, that's going to mean you can't sell to any of these dozen countries, could potentially have a really significant effect. And I think there's a lot of very smart, dedicated people working on trying to make that possible now in a way that it just hasn't been for the last dozens of years.
Yes, no, that's a really great idea, actually, that you lose not just a single market where you sold the product that is substandard, but perhaps a group of countries. And it occurs to me that something that would be very possible to implement, at least on the African continent, because there are great efforts to harmonize the regulatory approaches across the different regions like East Africa, West Africa, and so forth, with the African Medicines Agency, which is going to be a continental body to regulate medical products. So that would certainly be the kind of approach that would perhaps cause these manufacturers some pain and perhaps help them to motivate them to modify their behavior. Now, just one last question. It occurs to me that in talking about the solutions, we are often just focusing on what the regulators are doing. Of course, they play a key role in enforcement and forcing manufacturers to be compliant. But are there any instances that you're aware of where manufacturers themselves are stepping forward and leading to say that we want to be part of a solution to solve this challenge of counterfeited medical products?
That's a great question. I think, unfortunately, I'm not aware of one, which doesn't mean it doesn't exist. I also think a challenge is the numbers I've heard could be a little bit dated, but in India alone, there are more than 8,000 manufacturers. And of the cough syrup instance, for example, was from pretty small operators that I don't think anyone would have made a priority if this instance hadn't happened. So I think there are certainly efforts that the manufacturers can make to differentiate their products. I think there are incentive programs that if they can charge slightly more for a pre-qualified product or otherwise can make a difference. But to really make sure that no bad product gets into our market is something that will ultimately always be at the hands of regulators.
Yes, that's very true. Kendall, Taggart, thank you so much for joining Utano podcast today.
Yeah, thank you so much.